And also Trenton, he is a Trenton young man. I won't say boy. Welcome, Dr. Simone.
Thank you, Linda. Thank you very much.
Okay, now this evening we're going to have a topic tonight. We're going to try to keep it as general as we can for the common person, and I am the common person, and I read the article. But we're going to talk about vitamins used with chemotherapy and radiation therapy should a person be diagnosed with cancer and in their treatment. Now, I'm going to read this brief statement, and then we'll go straight to you, Dr. Simone. Some in the oncology community contend that patients undergoing chemotherapy and or radiation therapy should not use food supplement antioxidants and other nutrients. And there are other oncologists at influential oncology institutions that contend that antioxidants actually interfere with some of these treatment methods. And I'm going to stop right there, and I'm going to let you kind of take the ball from there. So I know you recently published this article. Why don't you start off by giving us a little bit about why you did this article and the whole reason this came about?
Sure. Well, you know, 2 of every 5 of us in America will develop cancer in our lifetimes. And that's a very sad but sad truth it is. And we also know, worse, that since 1930, we have made limited progress in the treatment of adult cancers in this country. Now, how do we know that? Well, these studies are published every year in the American Cancer Society journal called CA, a Clinician's Review. And every year, these studies come out from the National Cancer Institute and show the same thing. Since 1930, we've made limited progress for most adult cancers. And what we now know is that we've done everything. We've done chemotherapy, radiation therapy, immunotherapy, fancy technology, all the billions and billions of dollars we've done in research, and still not a lot of progress for adult cancers. Children tumors, lots of progress, not for adults. And we know that radiation and chemotherapy still need to be used during our treatments, but they continue to produce lots of side effects. So a long time ago, in the late 70s, the armed forces produced 2 prescription medications. One is called amifostine, one is called dexrazoxane. Both of these are antioxidants. Antioxidants scavenge some harmful chemicals. These are prescription medications that the cancer doctors use every day, and they have no problems in doing that because it's a prescription medication. But now the oncology community says in 1997, I'll tell you how it came about, don't use antioxidants if it's in a food supplement, vitamin mineral.
Why is that, though?
Well, in 1997, in a front page article of the New York Times, Dr. Larry Norton of Memorial Sloan Kettering said this. Research at Sloan Kettering showed that large doses of vitamin C could blunt the beneficial effects of chemotherapy for breast cancer. He said also folic acid, a B vitamin, interferes with the effects of methotrexate, chemotherapy. Now, that research that he talked about wasn't published for 2 whole years. And when it did get published, the publication was important because it showed that vitamin C can enter the mouse cancer cell, not a mouse issue, but a cancer cell of the mouse. And it showed that extra vitamin C went into the mouse cell. And that's great. That was a great find on his part of this other person. The second person, then at a news conference in 1999, now originally the first statement was 1997. 2 years later, 1999, this person, Dr. David Goldie, said he leapt to an erroneous conclusion. He said that vitamin C is extra in cancer cells, and therefore it will interfere with breast cancer treatment. Now, he couldn't have said that. He shouldn't have said that because vitamin C was found in a cancer cell of the mouse, not a human, and you can't translate cell information to animal information, much less to human information. So he just went overboard in his findings.
He was a little zealous.
I would say that. That would be a very good thing to say. But because of his statement and because of the first page article in 1997, New York Times, 2 people from an influential institution like Sloan Kettering those two people's words became the truth. And people around the nation, around the world, all the oncology people, patients, major organizations, including a very famous cancer organization, and multiple websites took the same position that vitamins and minerals should not be used during chemotherapy and radiation therapy, even though they only looked at vitamin C, and even though that was erroneous to begin with. But it soon applied to all vitamins and all minerals during chemotherapy. And this then took a life of its own.
So just from one erroneous statement, they kind of threw the baby out with the bathwater.
Right. Now, there is some logical but seeming logical information that should happen. For instance, radiation therapy involves the treatment by way of free radicals, a harmful chemical. It causes a chemical reaction in the cancer cell. Certain chemicals, like chemotherapies, also cause this harmful chemical, and that's how effects kill. But certain vitamins interfere with that. But remember what I told you, 2 prescription medications interfere and show that there's no harm with chemotherapy, radiation therapy. So prescription medications that are well used by doctors around the country as an antioxidant, they have no problem in doing so. But they say to the patient, don't take anything by mouth, a vitamin mineral by mouth, because it was said by these 2 people wrong information. So what we did because of that, because of this tremendous misinformation, we decided to look at the data. And there was voluminous data to look at. There was data since 1970 in the literature from this nation and around the world involving 50 studies that we then reported on in this journal that was just published, Alternative Medicine in Health and Medicine. And we'll talk about this article.
Now, I want to stop you right there because I know that for those of you who are listening to Dr. Simone, you hear him say "we," and I want to give props where props are due.
Yes.
Who helped you write this article,
Well,
Dr. Simone?
My wife is a research nurse, a cancer research nurse,
Victoria Simone.
And my 2 children now are physicians, young Charles and Nicole, both doctors, and they also helped me write this. So 3 of us are doctors and my wife a nurse. So we put our heads together, we looked at this information, and reviewed 50 human studies. We're only talking about human studies in this article, and showed that the reverse should be done.
Now, I just wanted to bring that out because I think that what you can see is that this is truly a family endeavor, and that
It's a family of scientists.
a family of scientists,
Right.
but you're very committed.
Yes.
And I speak from public knowledge and professional and personal knowledge because I've worked with at least 3 of you,
Yeah.
and I know it works. Now, tell us a little bit. I know you talked about what they use as far as what they prescribe
Right.
with the chemotherapy
Yes.
and radiation. But are there antioxidants that people can
Yeah. Antioxidants are well known to all of us.
Okay.
For instance, we know what free radicals do. They cause the green hue on statues. That's free radicals.
Oh, okay.
Rancid butter is a free radical mechanism. And the aging process, believe it or not, is free radical mechanism. That's how we get old, by free radicals. Now, anti-free radicals or antioxidants are things like vitamin C, vitamin E, selenium, beta-carotene, and carrots, and anything of color.
Okay.
So these are important antioxidants, vitamins that we know about, that we take every day in our food, but we should also take them as supplements as everyday people.
And I guess especially if we're undergoing either of these treatments for cancer,
Yes.
like chemotherapy or radiation.
Yeah.
Now, we're going to take a break briefly,
Okay.
and we're going to come back because I have at least 5 other questions, because when you mentioned antioxidants, I love to talk about broccoli, carrots,
Sure.
and different
Sure.
things that we can take. But I also always like to talk about nutrition
Right.
and how we need to supplement what's going on.
And we'll also talk about the actual findings of these 50 studies to help people who are undergoing treatment.
And this will be wonderful because you know what I always say, knowing's half the battle.
Yes.
This is WIMG AM 1300 and WZBN Channel 25. And of course, you can always find us on the World Wide Web at WIMG1300.com. We'll be right back.
This is Larry Feldman, General Manager of the all-new Colonial Hyundai of Ewing, New Jersey. Now through the end of the month, I'm slashing prices on every new Hyundai model in stock by up to 35% off the posted dealer price. You heard right, up to 35% off the price of every new Hyundai in stock at Colonial Hyundai. And for a limited time, buy or lease any new vehicle and receive a complimentary flat-screen television, courtesy of Colonial Hyundai. Drive a brand new 07 Hyundai Sonata from just $99 a month. Drive a new 07 Tucson from just $109 a month, or a new Santa Fe from just $189 a month. And at Colonial Hyundai, we'll even double America's best warranty up to 20 years or 200,000 miles. It all adds up to the best value on the road, and it's only happening for a limited time at Colonial Hyundai. Olden Avenue in Ewing, next door to Home Depot. Check us out at colonialautocomplex.com.
07 Sonata is $99 per month plus tax for 30 months with a total due of $4,817.13, including $2,300 rebate. 07 Tucson has a total due of $11,585.99, and 07 Santa Fe is $189 per month plus tax for 30 months with a total due of $4,052.42, including $1,550 rebate.
Hi, and this is In the Public Interest. My name is Linda Johnson, and we are back. My guest this evening is Dr. Charles B. Simone, MD, who's a internist, immunologist, radiation oncologist. I should know this off by heart by now, who is here in Lawrenceville, New Jersey, and he is our guest this evening. And we're talking about vitamins used with chemotherapy and radiation therapy.
Right.
Now, Dr. Simone, why don't you continue on a little bit about what else we found with the study that you talk about in the article?
Again, we published this new article in this journal here called Alternative Therapies in Health and Medicine. And this is a two-part series. This is published in January and February. The next one will be out in March and April. Okay. And what we found, we reviewed 50 human studies. Now, these studies were a huge number of patients. Almost 10,000 patients were involved in these studies. We only looked at human studies.
Okay.
Because we looked at all the animal studies and all the test tube studies. Almost 267 studies were published over the years of 1970. And the animal studies and the test tube studies all show the same thing. We can actually not interfere with chemotherapy. We decrease the chemotherapy side effects, and we actually increase the kill rate. But in human studies, that's where the big payoff is. What happens in the human? Can the human take simple vitamins by mouth and have benefit? And that's what we looked at. So 50 human studies were reviewed. Okay. Almost 10,000 patients were involved. Of those 10,000, 6,000 almost took vitamins and minerals, whether they be vitamin C, vitamin E, antioxidants, things like that. 6,000 took the vitamins, and of those 6,000, 4,000 had increased survival. I want to come back to that in a minute, because that's a big deal.
That is a big deal.
There was no interference at all. No interference with chemotherapy, radiation therapy. They all did the right thing. Those who took vitamins and minerals during chemotherapy, radiation therapy, all had lesser side effects. Now, in cancer chemotherapy, we know from lots of people in our families, chemotherapy, radiation therapy produces lots of side effects.
Yes.
And if you can decrease side effects with simple vitamins and minerals, that also is a big deal. So they all had minimal side effects. Secondly, they had less problems with their normal tissues. Their normal cells were protected by the vitamins and minerals.
Oh, now that's interesting.
And thirdly and importantly, there was increased kill. The therapies, chemotherapy, radiation therapy, together with the vitamins, antioxidants, and other nutrients, actually produced higher kill rate of the tumor.
So you're saying that by including these nutrients, it increased the kill effect
That's right.
of the chemotherapy and or radiation.
There was more shrinkage of the tumor compared to the person who didn't take vitamins. There was less side effects of the person with vitamins than compared to the person who didn't take vitamins. And in 2/3 of the patients, 4,000 patients of 6,000, a lot of people, they live longer.
You know, Dr. Simone, just that right there tells me quite a bit. Because I am a cancer survivor, and you and I talked about this, and I was like, the worst thing in the world was the side effects.
Yeah.
Did it have to take so long? And of course, through research and clinical trials and different things, we learn, and of course, it's better and better today. So what I went through, we don't always have to still go through that.
But remember, again, we had much of this published in our book, Cancer and Nutrition, In 1981, we talked about it, and we also did a review of it and a revision of it in 2005. But the point is survival. Now, that's a key one.
Right.
Remember what we talked about initially when we opened up. We said survival is limited and not a lot of progress made for adult cancers. And that's been shown by the American Cancer Society using the National Cancer Institute data. But here we have in these studies, if people use simple vitamins and minerals during time of chemotherapy and radiation therapy, almost 2/3 of them live longer. That's a big deal, and without any harmful side effects.
Now, I know you've talked about the antioxidants and the additional nutrients, but what exactly? Do we have a list of what patients should take?
Yeah, it's very easy, and people can go over the counter and buy this kind of information, buy these nutrients. For instance, beta-carotene. They should take about 20 milligrams of beta-carotene a day. That's a good dose.
Okay.
Now, what does that mean in terms of carrots, for instance? Well, to get that amount in carrots, you need about 20, 25 carrots a day to get 20 milligrams in a pill.
I hear
So it's not possible. It's not practical. We're not grazing animals. We need to get it from our food, from our pills. Vitamin C, probably about 350 to 1,000 milligrams a day is important. Vitamin E, 400 units a day in the solid form, not the oil-based soft gel, but solid form. And selenium, 200 micrograms a day. And all of these can be bought over the counter. Very simple. You don't need prescription, and very helpful to you. And this is helpful to anybody, by the way. In addition, people should be taking B vitamins. They help enhance the immune system. B vitamins also help cancer cells die off better. And other vitamins, vitamin K, these things we know will also kill cancer cells.
So I guess what you're saying is it certainly wouldn't hurt any of us to supplement.
Well, a study
what
that was
we're doing.
a study done by the USDA in 2004 published showed their own work from their own database that the food supply today, that is 2004, compared to 1975, had anywhere from 14% less to 400% less nutrient levels in the foods compared to 75.
So you're saying we really do need these supplements.
We do need supplements because typically in an American population, whether you're rich or poor, educated or not, you have anywhere from 1 or 2 or 3 marginal deficiencies. So you need to supplement your diet, and particularly the cancer patient should certainly supplement their diet.
And that makes sense. Now, when we started off at the top of the show, I started by saying some in the oncology community.
Yes.
So now after hearing everything that you've said, of course, I know, because I might say it myself, aren't there going to be some out there, some docs, some researchers who are going to say, oh, no, don't do this.
Yeah.
Some naysayers.
Well,
what do we say to them?
I tell them and I tell patients this. Leave your beliefs in the church and in synagogue. When you come to the medical establishment, bring factual information, scientific facts, peer-reviewed information. When a patient comes in, I asked them, well, the doctor told you this? Yes, I can't take vitamins. I said, okay, but here are the facts. Here are the facts. Ask your doctor to give you the facts in a peer-reviewed medical journal. They can't do it because there is nothing like that. So there will be naysayers, and in any revolution, if you will, of information, you're always going to have that period of time when people are always against it. But this is what we have to go through, growing pains, but importantly, show the specific data, scientific data, to show that vitamins and minerals taken during chemotherapy, radiation therapy, will do several things. Not interfere with the treatment, increase the kill rate of the treatment, decrease the side effect of the treatment, and in a portion of people, increase the lifespan.
Now, one thing that you've touched on more than once since we've been here discussing this, and I have to admit, when I first read the article, I was very impressed because I am a layperson, and I was pretty much able to understand it. But I think a lot of what you're saying is also coming back down to nutrition.
Yes.
And in the book that you do on cancer and nutrition, of which we use it a lot, and we talk about the 10-point plan for prevention and cancer life extension.
That's right. Well, that's the component. So to extend life in a cancer patient, particularly a patient with a diet-sensitive, hormone-sensitive disease, like breast and prostate and colorectal and endometrium, these are all diet-related tumors. You need to be on a low-fat diet, high-fiber diet, avoid four-legged animals, Avoid dairy products unless it's skim or non-fat, and avoid shellfish. Those three things particularly. Also, you should avoid soy products. Soy products are also in lots of things. Shampoos. You need to read the label on your shampoos.
If I use a shampoo with soy, even though I'm not ingesting it?
It'll penetrate right through the skin. So you need to read the label. So those are the nuts and bolts. Diet. Vitamins and minerals are important. Avoid smoking. Avoid alcohol.
Oh, yes.
Exercise. Stress modification. These, when modified your lifestyle, you will actually extend your life.
Wonderful.
And lots of studies show that.
And I know that you've gone over that a lot in your book, and we've talked about it when we've done various things. Now, I know you said the second part of the article is coming out.
Yes.
What are you going to just kind of, high level now?
Yeah,
Don't get too technical.
No, the second part of the article will be more of the same with different nutrients. For instance, the first part will talks about vitamin A, beta-carotene, vitamin C. Part 2 revolves around the other antioxidants like selenium.
Okay.
Combining it with vitamin C. Combinations of vitamins and minerals. Looking at the B vitamins, looking at selenium by itself, glutathione, individual, and more of the same. So there are 50 total studies in all that had to be divided up into 2 papers, and that's all it is.
I understand now. Can people who might be interested in this, or perhaps, I know me, I'd be tempted to take it to my doctor and say, I read this article, or I got this article. Is there any place we can find it? Or
well, they can email me, and I can email them the link for this article that they can download from the web, this peer-reviewed journal.
Okay, now, I know we don't have Dr. Simone's email address, but I know his number off by heart, 609-896-2646.
That's
and
right.
Mrs. Simone's probably going to kill me, but ring it off the hooks, okay? And is there anything you'd like to say in closing?
Well, we have control. That's the key thing. We can prevent disease. We can prevent cancer and heart disease from ever happening, because only 10% of cases are related to genetics. And if we do have an illness like cancer, we can actually improve our lives and extend our lives if we change our lifestyles. The choice is really ours. We can do it.
And I like that, because I like to think that we are in control.
And we are.
Thank you, Dr. Charles B. Simone. And this is In the Public Interest. My name is Linda Johnson, and this is WIMG AM 1300. WZBN Channel 25, and of course you can find us on the World Wide Web at WIMG1300.com. Thank you.